Keep an eye out. I like to start facing that direction. Yeah, we try to like Alright, how many do you need? Shut down DC, group of trouble, etc. I'm fast. Yep.
Sorry. Oh, hi. About Metro DC today. Hi. Naomi. Nice to meet you. We just did one round of names, but we can do it again because we might as well. Yeah.
I'm streaming, so I turned away to not get people's personal information, so I'll step over here.
That's cool, by the way. I didn't have time to. Yeah,
I'm just worried about your aim.
I don't have anything.
I'll think about it.
Okay. So I think that what we're going for today is, as Nadine would say, the minimal viable action. You know, this is a global day of action. We're adding another one to the map. I think we can get some good photos of it and probably be out of here in a half hour.
Cool.
Does that sound good? Unless people want to stick around longer. Who has a chant?
You could just do people over profit. Free the vaccine.
Yeah.
Free the vaccine?
Right.
No one is safe until everyone is safe.
Yeah.
That'll look something good.
Yeah. If you say it loud enough, then.
All right. Yes, she should. Yeah.
She'll probably come. That will be my guess.
What's
Yeah,
that?
yeah. I said, does she know where she's going? Yeah.
Yeah. You know, she'll be here when she gets here. Or we'll be going. What? So let's go across the street and stand in the street corner. Yeah, we have a custom-made banner, so people have to hold it. Yeah, everybody's got to hold a sign so we get more signs on their people. So,
Tons of pretty ones. Yeah, we have to hear it. Yeah, we just went up there. Here we go.
yeah.
Everyone was like speaking in Hampton. Let's bring one and then we can always push one up. Type of the media, the live streaming.
People over profit! People over profit! People over profit! People over profit! People over profit!
People over profit.
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 So we're here today outside the headquarters of the pharmaceutical industry's lobbying group, Pharma, to demand that we free the vaccine. The pharmaceutical companies like Pfizer and Moderna and Johnson & Johnson, they lined up and they took billions of our dollars to make this vaccine, and that's great. That's only one step of it. Now they're trying to profit off of our investment in the vaccine, and what that's going to do is it's going to make it impossible for people around the world to be vaccinated in a reasonable time frame. You know, here in the U.S., the vaccine rollout is going way too slow. But there's parts of the world, global south, where if things don't change, we won't be fully vaccinated until 2024 or later. That's unacceptable. That's unacceptable. We're here because we want to put people over profit. We're here because we know that unless we're all safe, none of us are going to be safe. Right? So, Naomi's first, right? LaDon's not here. So Naomi's up.
Woohoo, Naomi! Yay! You can put your sign up.
That's good? Okay.
Can we hold our sensor? Go ahead.
Okay.
Yeah, wanna say
So
that?
I'm here, yeah. I'm here on behalf of the Advocacy Network for Africa. Particularly its COVID working group. The Advocacy Network for Africa, also known as ADNA, is a coalition of members that work to raise the level of understanding and attention to current events in Africa and the international policy and funding with members of Congress, President, administration, and international organizations like the United Nations and the World Bank. With the Advocacy Network for Africa's COVID-19 working group, we've been working on advocacy for the release of special drawing rights from the International Monetary Fund for debt suspension, debt cancellation, and for debt relief and protection of healthcare workers. More recently, we've been working and advocating for equitable vaccine distributions with an increased focus on the TRIPS waiver. In October, India and South Africa formally proposed to the World Trade Organization Council for trade-related aspects of intellectual property rights to waive certain intellectual property provisions of the TRIPS agreement. This will allow for local manufacturing of COVID-19 health products until widespread COVID vaccination is placed globally. Healthcare in Africa is quite fragile. It continues to face systemic neglect, inadequate funding, and extreme shortage of skilled healthcare workers. COVID-19 has exposed several dimensions of this fragility, such as lack of local medical tools and medicines, and a reliance on importing essential life-saving pharmaceutical supplies and drugs. Healthcare in sub-Saharan Africa remains the worst globally, with few countries able to spend the money that the WHO considers the minimum for basic healthcare. Currently, most African countries are experiencing devastating economic conditions generated by COVID-19. A World Bank report released that in 2020, COVID should drive 40 billion people into extreme poverty, thus erasing at least 5 years of progress in fighting poverty. Such an economic collapse will negatively impact much more than the effective handling of COVID-19 pandemic. Supporting African countries is in the interest of the United States. Over 100 countries are supporting the TRIPS waiver, but the US is not because of Big Pharma. The US is not safe until we are all safe. If COVID-19 has taught us anything, it's that we are all in a global village. COVID-19 has underscored for us that no nation is an island, especially during a pandemic. Our safety is intertwined. There is precedence for the TRIPS waiver with HIV medication. We should not wait for COVID-19 to claim as many people as the AIDS did before TRIPS waiver for ARVs. Thank you.
Yeah.
Free the vaccine! Free the vaccine! Free the vaccine! Free the vaccine!
Free the vaccine!
Free the vaccine!
Free the vaccine!
Free the vaccine!
Free the vaccine!
Free the vaccine!
Free the vaccine!
Free the vaccine!
Free the vaccine!
Free the vaccine!
Free the vaccine!
Free the vaccine!
Free the vaccine!
All right. So next up is a really awesome organization that we've seen this this show before. Like Naomi said, during the AIDS and HIV epidemic, and a group of university students from around the world got together and said, "Hey, our universities are funding AIDS research. We want to make sure that people around the world have access to essential medicine," and that's what Universities Allied for Essential Medicine has been doing for a really long time. This is their thing, and Meredith is an awesome partner. And, let's hear it for her.
Hi everybody.
Hey!
Hey.
Can you hear me?
Yeah!
Great. Thank you, Patrick. So first of all, for me, it's been 15 months since I've been able to travel to see my family. My nephew was 1, he's now 2 and has a little sister, and my elderly parents are waiting for us to be able to be reunited. How many of you here have a similar story? My name is Meredith Basie, and as Patrick said, I've been working with Universities Allied for Essential Medicines for a long time, and our history is in the HIV/AIDS movement. And 20 years ago, in another pandemic, students organized and they fought back and they pushed their university to change the license between their university and a pharmaceutical giant, kind of like the ones represented behind us here in the Pharma Lobbying Institute, and they won. And it led to a 90% reduction in the price of that drug, and enabled Doctors Without Borders to treat people living with HIV for the first time. 20 years later, and in April of last year, we decided to do the same thing again. We have been organizing now with people in 30 different countries around the world to push for access to COVID-19 tests, treatments, and vaccines, so that everybody can afford them everywhere, and they're available to everyone, free at the point of delivery. And we don't say free because we already pay for them, right, with our taxpayer dollars. So we need a people's vaccine and not a profit vaccine. COVID-19 has made it abundantly clear that we need a healthcare revolution in this country. If not now, after 500,000 Americans have died, then my God, when will that be? Healthcare is a right and not a privilege, and we shouldn't have to say that in 2021.
Right.
Right? Are you with me? Healthcare is a human right. And yet, simply by living in the United States, or my family living in the UK, we are still at the front of the global line for who has access to this vaccine and any new medication for COVID-19. It is not fair or right that my friends in Ecuador who are sitting at home locked up, their hospitals overflowing, and the death rate's much higher than what is shared on the news. They don't know when the vaccine will arrive there and who will get access and when they will be able to protect their families. To me, that's not fair, it's not right, and it makes me angry. Despite the development of a COVID-19 vaccine with our taxpayer dollars, there is a long, long wait for most of the world, and we need to act now. Pharma, hello?
Hey, Pharma!
Pharma?
Hey, Pharma!
Are you there? We're here for you. We have a message.
No, I'm not.
And I know you're probably perhaps in your second home somewhere else, working from home. But we're here to tell you, we know that you've made billions of profit from the research that we paid to develop. And it's time that you shared. Surely your mothers told you that, and your fathers, that it's good to share. And it's time that you shared with the world so that we can all work together, have access to the vaccine, and curb this pandemic as quickly as possible, preventing lives from being lost in suffering. We must demand the pharmaceutical corporations in this country and around the world, and governments, including the Harris-Biden government administration, that they share the vaccine via a mechanism called CTAC, the COVID Technology Access Pool. The sooner we do this, the sooner we can end this. Thank you. It's time we free the vaccine.
Free the vaccines!
Oh. Who's up next? Sir?
Does one of your students want to speak?
Oh, yes, she's up here.
Oh, okay.
We'll do that next. See, it's trying to find out. Who is with me when I say health is a human right? Health is a human
Right.
Health is a human
Right.
Health is a human
Right.
Medicines for people.
Not for profit!
Medicines for people.
Not for profit!
Medicines for people.
Not for profit!
Awesome. So next up we have Allie from Public Citizen. Public Citizen is one of the organizations that has been leading the fight to free the vaccine here in the U.S. and globally. Thanks so much, Allie.
Thank you.
Hey, can y'all hear me?
Yep.
Wonderful. My name is Allie Bancroft. Thank you so much for having me. I'm from Public Citizen, and it is a pleasure to be here today. So, we're talking a lot about a people's vaccine.
Why do we need that? Well, I think first and foremost is that we don't want millions of people around the world to die needlessly. Secondly, our governments have already invested billions of taxpayer dollars to bring these vaccines to market, and we need to see the return on that investment. Thirdly, the longer we wait to have population-level access to this vaccine, the more mutations will arise, which makes the existing vaccines less effective. And lastly, the longer this goes on, the more expensive it is for the global economy, and trillions of dollars will be a burden that fall on the U.S. government. So we have so many different incentives to do this. So, what are the asks? What do we need to happen? I propose that we ask the Biden-Harris administration for 3 things. Support the TRIPS waiver, ensure that we have trade agreements that allow for population-level access in public health. Secondly, support CPAP and the sharing of COVID technology. And then lastly, to invest money to expand manufacturing capacity so we actually have enough vaccine for all of humanity immediately. Thank you very much, and y'all keep pushing ahead.
People over profit! People over profit! People over profit!
People over profit!
People over profit!
People over profit!
People over profit!
People over profit!
People over profit!
People over profit!
People over profit!
People over profit!
People over profit!
People over profit!
People over profit!
People over profit!
People over profit!
People over profit!
People over profit!
People over profit!
People over profit!
People over profit!
People over profit!
People over profit!
People over profit!
People over profit!
Anybody else have anything on that? Any other chance?
Fuck big pharma!
Is there a pharma sign somewhere around here that we can make sure that...
They're too afraid to put up a
Oh, they're too afraid to put up a sign.
It says Pharma on that vaccine, and it says Pharma on this vaccine, but that's it.
Okay.
So it looks like after we're done, we're going to be able to leave behind a little message. What does it say on the vaccine up there?
Free the vaccine!
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 People over profit!
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 Healthcare is a human right! Healthcare is a human right! Healthcare is a human right!
Healthcare is a human right!
Healthcare is a human right!
Healthcare is a human right!
Healthcare is a human right!
Healthcare is a human right!
Healthcare is a human right!
Healthcare is a human right!
Healthcare is a human right!
Healthcare is a human right!
Healthcare is a human right!
Healthcare is a human right!
Healthcare is a human right!
Healthcare is a human right!
No one is safe. People all are safe.
Can you all hear me?
Yes, yeah.
All right. All right, we're going to start off with a chant. I'm going to say no justice. Now, you know what to say, right? No peace. All right. No justice.
No peace!
No justice.
No peace!
No justice.
No peace!
No justice.
No peace!
All right. We are here to create noise. All right? I think we're all fed up of needless deaths, which are happening purely for profit. Nobody needs to die. But I'm going to tell you something, because I'm a doctor in this city, and I've seen what is happening even right now. Right in this city, black people in Ward 7, Ward 8, and all across the city are not getting equal access to the vaccine. This is by design. The very reason that oppressed countries are not getting the vaccine is the reason that black neighborhoods, immigrant neighborhoods are not seeing the vaccine. We need to make that connection because it is the same thing. This is called vaccine apartheid. Let's call it what it is. People are dying for profit. We cannot stay quiet. That's why no justice, no peace. No justice, no peace. America has what, 5% of the world's population? Is that what it is? And how much vaccine do we have? 68% of pre-sales of the Moderna vaccine were bought by the US already. Wow. The US, UK, EU have monopolized complete sales and hoarded vaccines. Now those vaccines are being discarded because there isn't a distribution plan. So vaccines are going to waste in this city right now, in this country right now. One doctor was already fired for giving to-be soon expiring vaccines to people. What are we doing with hoarding vaccines? What's the point? Why isn't the rest of the world getting equal access to the vaccine? This is a pandemic. We do not end pandemics by hoarding supplies. We cannot, period. And neither are we going to end the epidemic in America. Because there will be new mutations, like they already are, and they will be used to again make more profit. This cycle will continue unless and until we stop it right now. Which is why we are here to say no justice, no peace. Free the vaccine.
Yeah.
Free the vaccine! Free the vaccine! Free the vaccine!
Free the vaccine!
Free the vaccine!
Free the vaccine!
Free the vaccine!
Free the vaccine!
Free the vaccine!
Free the vaccine!
Free the vaccine!
Free the vaccine!
Free the vaccine!
All right. Free the vaccine!
Free the vaccine!
Free the vaccine!
Free the vaccine!
Healthcare is a human right!
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 People over profit! People over profit!
People over profit.
People over profit!
People over profit.
People over profit!
People over profit.
Free the vaccine!
Free the vaccine.
Free the vaccine!
Free the vaccine.
Free the vaccine!
Free the vaccine.
No justice!
No peace.
No justice!
No peace.
No justice!
No peace.
Free the vaccine!
Free the vaccine.
Free the vaccine!
Free the vaccine.
Free the vaccine!
Free the vaccine.
What do we want?
People's vaccine.
What do we want?
People's vaccine.
When do we want it?
Now.
Where?
Now.
Take vaccine apartheid. Take vaccine apartheid. People over profit.
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 Vaccine?
Our vaccine.
Who's vaccine?
Everybody's vaccine.
Yeah.
Not yours.
What do we do?
Rise up, fight back.
What do we do?
Rise up, fight back.
When our healthcare is under attack, what do we do?
Rise up, fight back.
When our healthcare is under attack, what do we do?
Rise up, fight back.
When our healthcare is under attack, what do we do?
pretty much anywhere else on the planet. 20 times. And yet, every year, the taxpayer spends a minimum of like $41 billion into new medical research. We put all of this money into investing into the best technologies for the people, supposedly. And yet, when we do come up with an extraordinary innovation, like the new mRNA vaccine, what happens? We develop them and then we don't have a distribution system because we don't have a universal healthcare system to make sure that they are distributed in a just and equal manner. That has to change. We have to free the vaccine, of course, but we also need to be pushing for these massive systemic changes to ensure that everybody gets access to the life-saving medicine that they need. And of that 1 in 5 people in the global deaths happening here in the US, 1 in 5 of those are our black and brown friends and family members. Their risk is not because there is something different about their biology. It is simply because of racism and lack of equity in the healthcare system. And this has to be addressed. If we care about access to medicines, it is a racial justice issue, and we need to put those things together. The access to the vaccine is about everyone, and as we mentioned, if we want to keep us safe, we need to keep everybody safe, not just in this country, but around the world. So I'm now going to pass it over to my friend and colleague, Master. Hold on. Who is a university student at the University of Maryland. And she has been fighting on the front lines for this work and pushing her university to push for change. Master.
I've never used one of these before. Okay. Thank you, Meredith, for the introduction. Hi guys, I'm Mansa. I'm a sophomore at UMD, and I'm here today representing UAEM and Free the Vaccine. So, as most of you probably know, today is the 1-year declaration of Corona as a global pandemic. And 1 year later, our cases are spiking. 1 year later, and global health inequity is only getting worse. And yeah, there are vaccines out there now, but what good is a vaccine if most of the world doesn't even have access to it? We are dealing with a communicable disease, and that means that this pandemic is not truly going to be over until the whole world is vaccinated. Not just the US, not just the UK, not just Canada, not just these high-income countries that are stockpiling all of the vaccine. There are over 100 countries, and of course all of them are low-income countries, that haven't gotten access to even a single dose. And that's not something that we can just sit by and accept. How are we going to beat this global pandemic if half of the world doesn't even have access to the vaccine? And why doesn't half of the world have access to the vaccine? Well, that's because these big pharma companies like Moderna, Pfizer, J&J, they're keeping their knowledge about the vaccine all to themselves. They don't want to share their know-how because then, of course, they would have to sacrifice some of their profit. And we know these companies love their profit. So the US has the power to address these global issues, and we need to push the administration to fulfill this responsibility. Empty words and promises are not going to take care of a global health crisis. We need to push our institutions to sign on to CTAP, to support the TRIPS waiver, to, for once, put people over their agendas, to put people over politics, and to put people over their profit. If IP and patents are what's getting in the way of us dealing with a global pandemic, then that's quite honestly just sad and very disappointing for us as a nation and for us globally. Most of our institutions claim to be at the forefront of health and equity until it comes time for them to actually put their money where their mouth is. It's time that their actions start matching their words. The World Health Organization supports CTAP. Dr. Fauci has endorsed it, and just yesterday, Bernie Sanders has also publicly supported Free the Vaccine. Yeah, woo! And he's supported a globally accessible vaccine. So how many more people do we have to lose to this pandemic before these institutions get it together, share their knowledge, and finally vaccinate not just these countries, but the whole world? Health is a human right. It's a universal human right. And thank you to everyone here today fighting for that right. The people of the US deserve access. People on a global scale deserve access, and these pharma companies need to step up. I'm not sure who to pass it on to. Okay.
Awesome. Thank you so much. Thanks to all the organizations who pulled out the song and the organizations who helped make this happen. I think that we didn't hear from TSA, but they were they were a major part of this. Justice is Global. Who else gets shout outs? Shut Down DC. What's that? Beautiful Trouble. Yeah, Beautiful Trouble. So this is just I think it's amazing that there are actions that are happening all over the world today, and that's a major step forward in having a global movement for to ensure that healthcare is a human right. Because in really, like, think about what they're what the pharmaceutical companies are doing. They know how to make a vaccine that can save lives, and they won't let anybody else make that vaccine. That's really what's going on here. And I think that most of us, I'm assuming most of us, have pretty good ideas about the world and solidarity and standing together in global justice. And that's certainly what motivates me, and it motivates a lot of us. But let's also be clear, like we can't end this pandemic if we don't get everybody around the world vaccinated. If everybody around the world isn't vaccinated, we're going to see more virus, we're going to see more mutations, and we can't just put up walls around our borders. It's going to get into the U.S., and we're going to keep getting sick. We're going to keep losing friends and family members and relatives and neighbors to a vaccine, to this vaccine. So we need to get the vaccine out to everybody. And it's incredible that there's a global day of action today on the 1-year anniversary of this being declared a pandemic. Chances are we might need to push a little further. Will you be with us if we push a little further? Yeah. If we need to go have a conversation with the Biden-Harris administration, will you be there? Yeah. If we need to go talk to Johnson & Johnson, will you be there? Yeah. If we need to go to the IMF and the World Bank, will you be there? Yeah. If we need to go to the WTO, will you be there? Yeah. And if we need to come back here to Pharma to have another conversation, will you be there? Because we'll be back! We'll be back! We'll be back! We'll be back!
What we're doing.
Let's all
get it in. Yeah, there we go.
People over profit! 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 People over profit!
No one is safe. You say until everyone is safe. No one is safe.
Till everyone's safe!
No one is safe.
Till everyone's safe!
No one is safe.
Till everyone is safe!
No one is safe.
Till everyone's safe!
No one is safe.
Till everyone's safe!
Free the vaccine.
Free the vaccine!
Free the vaccine.
Free the vaccine!
People over profit.
People over profit!
People over profit!
People over profit!
No one is safe. Till everyone's safe.
Till everyone's safe!
No one is safe.
Till everyone's safe!
Pharma. You suck.
Pills cost pennies. Greed costs lives. Pills cost pennies.
Greed costs lives.
Pills cost pennies!
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 Greed costs lives.
And there was no person was talking.
guys are comfortable with masks. I've been wanting to ask you, but then I'm like,